So what are you actually looking for? If a patient were to come to see you, what would you look for that would tell you that they were going to develop an ulcer at some point?
We look for advanced changes. We look for brownish discoloration. We look for hardening of the skin areas. We look for patients that actually have had a little nick in their vein that bleed, and sometimes it's rather profuse or a lot. And then there's that progression from there to the skin starting to change into a whitish discoloration, and then to a frank ulcer.
Okay.
By that time, the patient is really way down the road, and a lot of this can be halted in terms of progression with what phlebologists do in terms of their practice. So, you know, patients usually come to me and they say, you know, my physician basically said, hey, you know, this is really not important to you. This is mostly cosmetic, and then they come with these ulcers. And I said, what happened? He said, well, nobody really told me anything that could be done. Nobody told me about conservative management with graduated compression hose. Nobody looked at my veins in terms of what we talked about, large veins having reflux or blood going down the leg instead of back to the heart, where it adds distension in your veins and pressure. Nobody told me about this. Nobody seemed to have known. And thank you that the phlebologists are now involved in this, and you can help us. And they really feel really better about it. And then we see those patients, and it runs in families. So these patients that have ulcers, we're tending to see advanced disease in some of their offspring, and we then educate them to understand what's going on, and then they transmit that to their children, and that's wonderful.
So it really sounds like education is the name of the game. We need to educate physicians so that they don't say to their patients, if your veins don't hurt, you don't need to do anything about them. And then phlebologists also educate their patients.
Correct.